Willowbrooke at Tanner's Partial Hospitalization Program, or PHP, and Intensive Outpatient Program, or IOP services are an in-depth counseling program staffed with mental health professionals who specialize in helping children, adolescents, and adults with mental health or substance use need. It is a structured program that provides counseling and medication management and can be used as an alternative to inpatient care, attending daily but returning home each evening.
Partial hospitalization is an important step in the road to recovery from psychiatric illness because there are many patients who, after acute inpatient stabilization, do require a step down before they go back to work, before they assume their previous lifestyle outside the hospital. Thus, it's a mechanism for them to resume previous functioning. Also, it's an important step because many patients may be able to stabilize without ever having to go to the hospital. It's a way of preventing hospitalization and keeping people back at home, back working with their families and engaging with their communities, and thus able to deal with issues as they are arising. First, on admission, you would come in, you would be meeting with coordinators that get the program set up for you. You'd be meeting with me or another psychiatrist. You would also be meeting with nursing staff, and you would be meeting with counselors. You would be going to groups 4 times daily with different foci of group depending on the type of clinical problem you're having. In addition, you may be having a meeting with family members, or you may be meeting individually with one of the counselors. So it's a fairly intensive program, usually starting from approximately 9 a.m. to about 2 in the afternoon. We do allow for meals while you are in partial hospital, and you would be interacting with other patients during the time. In addition, along with getting medical and therapeutic needs met, you'd be able to continue in other evaluations as they are indicated and establishing aftercare so that when you leave partial, you'd be able to follow up with an outpatient psychiatrist, get resources set up so that you're not just completely out on your own. Often patients are in a partial hospital program for a period of, say, 4 to 6 to 8 weeks, depending on the nature of the problem they're having and the progress that they are making. After a partial hospitalization, the patient would be referred to outpatient resources. That may be following up with a psychiatrist, say through Willowbrooke Psychiatric Services, seeing a counselor through Willowbrooke Counseling, or it may be referring back to the patient's personal psychiatrist or referred to another provider in the general area where the patient lives.
There are several ways to be referred to our programs. You can self-refer, you can be referred by your primary care provider, you can be referred by your private counselor, or you can receive a referral to PHP and IOP by receiving one of our free confidential screenings. To learn more about our PHP or IOP programs, please visit www.willowbrookeattanner.org or call us at 770-812-9551.